Good morning everybody. This image shows the skull from Neolithic era in which a procedure called trepanation or burr holing was done on a live patient. This was done in the Neolithic era and even until the 17th century as suggested by the famous physician William Harvey for migraines. We are going to talk about migraines today. Migraine is more than just a headache. It is an inherited tendency to have recurrent headaches with sensory disturbance. It is an instability in the handling of sensory input by the brain. There are many forms of migraine. The commonest, around 90%, is common migraine or migraine without aura. Other forms include migraine with aura, which can be visual, auditory. Other forms of migraine including chronic migraine, menstrual migraine, hemiplegic migraine, migraine with brainstem aura, migraine with abdominal symptoms, cyclical vomiting symptoms. Migraine is the 6th most disabling symptom in the world, and 20 million attacks of migraine occur daily. And 1 in 10, even up to 1 in 7 people suffers from migraine. Children are not spared from migraine. The male to female ratio is 3:1. We'll come to the triggering factors of migraine. There can be many triggering factors including abnormal smell, perfumes, lights, travel, sunlight exposure. There are a multitude of these triggers and each can be different from individual to individual. Migraine has classically 4 phases. First is the premonitory phase, in which there are warning symptoms, followed by an aura, which can be either visual or temporary weakness, and followed by the headache episode, followed by resolution. The risk factors in migraine include obesity, medications, age, sex, and even genetic predisposition. Recent evidence points that people who experience migraine with aura are more likely than patients without aura to experience a stroke. What causes migraine? There have been many theories put forward, and the most prominent one is the one with migrating electrical complex. Once your doctor encounters a patient with migraine, he may conduct certain neurological examinations, physical tests, blood tests, an eye checkup, and even an imaging if he suspects secondary causes for migraine. The treatment is multi-pronged. First, we have to treat the triggering factors, or those in which we can prevent a migraine attack from happening. Then are the treatment for acute medications for the acute pain, followed by preventive treatment which can extend up to months. The treatment options for migraine include pain relievers, triptans, anti-nausea drugs, Botox injections, antidepressant, antihypertensives, anticonvulsants, and even acupuncture. Most important is a headache diary so that your doctor will know how frequent you are getting the migraine attacks. So, starting from trepanation, we have reached at a point in which a simple nasal spray can help you get relieved of your migraine.